All right. Well, thanks everybody for joining us. I know this is being recorded, so people can check in later, and hopefully others will join us as well. But I am Amy Campbell, and I am the IARHC lobbyist. I also am a multi-client lobbyist. I work for several different other healthcare organizations, and I had my 30th year as a lobbyist at the Capitol this last session. So I've been around there for a little while, and I have lobbied off and on for the Iowa Association of Rural Health Clinics throughout my career. I am a former state public policy group staffer, along with with Virginia and Hannah, and Deb also is a former SPPG person, so I started out my career there. So I do a lot of work in the Medicaid health care insurance, kind of health insurance area at the Capitol. I work with the Federally Qualified Health Centers, Behavioral Health Association, and some other organizations too. So I'm really happy to talk about some of the changes that we've had in the to address Iowa's healthcare workforce shortage. When I first started working in healthcare, it was really hard for legislators to really believe that there was an upcoming crisis in the number of physicians and other healthcare professionals, particularly nurses, that was on the horizon. And I think people have been calling on legislators to do something, and the pandemic really put that spotlight on the issue. So you no longer have to get their attention. The issue is now what to do about it. And so I'm pleased to talk about some of the things that they did do. I think I want to start off by saying that the solution isn't a big master solution. It's going to be a series of smaller strategic efforts to make a dent in addressing the healthcare workforce shortage. And you can't go anywhere without hearing the word supply chain and workforce shortage, regardless of what your profession is in Iowa. So I'm going to go through these slides. If you would like to put a question in the chat, I will try to address it as we go along, or we'll pick it up at the end when we have some time for questions, and I can go back to slides if you need me to do that. But I will try to monitor the chat, or if Virginia, Deb, or Hannah sees something and want to break in with a question, I will try to answer that as we go along, so you don't have to wait too long for the answer. But I did want to start off with kind of it's going to be kind of I already know this because you're living this, the shortage, but just a snapshot of the healthcare workforce shortage. The Department of Workforce Development is doing a lot of data collection around healthcare careers, and it won't surprise you that the state's top 10 postings are in the healthcare area, with nurses topping that list at 5,192 openings. And so the Mayo Clinic did a quick survey during the pandemic to ask what people are thinking about in terms of what they're going to do in their careers. And you're seeing that 1 in 3 physicians, advanced practice providers, and nurses intend to either reduce their hours or somehow go to part-time or change the amount of hours in their practice. And 1 in 5 physicians plan to leave their practice altogether, and 2 in 5 nurses. So you're seeing that nationally, that trend. Of course, in Iowa already was pretty low in provider to patient ratio, and we're a recent workforce development study showed that we're 45th in that. Just to level set, Iowa has, and this is physician related, but Iowa has normally graduates about, or gains about 33 per year. And that is down during the pandemic. And the predictions are we need 160 a year to meet the demand. So legislators are seeing these statistics. They're realizing that there's something that needs to be done, and they're trying their best to find solutions that they can do that. And they are directing resources at it. So that's good news. And then it's certainly not a one and done, is what I want to start off with saying, so that you don't think that these changes are the last that you'll see of workforce, because they're going to make a dent. They're not going to address the overall situation. So when I was trying to put together this slide, I wanted to try to find a way to show all of the tweaks that they've made to current programs. So I put it into this chart because with the changes in red, because there are a lot of significant changes to our current loan repayment programs. And so building on those as the basis for starting to try to address getting people into, primarily we're talking rural areas. So it might be mid-sized towns, but it is in rural practice areas. So the first program, the Rural Iowa Primary Care Loan Repayment Program, is a physician-focused program. So it is focusing on those specialty areas. They noticed that neurology was not included in that, and so added that this year for a specialty practice. Did not change the size of the population of towns or the community match that's required, but did allow for part-time. So if you have a physician that maybe practices part-time in a larger community and spends half their time in one of the smaller rural practices, or if they're at, really just trying to limit the amount of hours that they're having after the pandemic and really wanting to refocus for a while, there is an option to do part-time work. Also, recognizing we don't have enough residencies in the state, legislators felt that it was important that we bring those Iowans back that had to go out of state for a residency. So if they went to Illinois or Minnesota or somewhere else for a residency, they would still be eligible for this program, whereas before they weren't, if they agree to practice. The idea is you want to get them into that local practice, and it doesn't matter where they did their residency at this point. So they did invest some additional resources into that program. They increased it by about $750,000, so up to $2.5 million available for that now. And I believe that legislators are going to be tracking demand for these programs to see where they need to put additional resources in the future. The second program is the Healthcare Professional Recruitment Program. And you might recall a couple years ago, legislators added, this used to be just for graduates of DMU, Des Moines University. No, I'm sorry. Yes, that used to be only for Des Moines University, and they expanded it to any Iowa college or university that offers a program in these health practice areas. So physician assistants, physical therapists, occupational therapists, athletic trainers, podiatrists, physicians, and this year they added nurses, so ARNPs or RNs to that healthcare for eligibility for the program. They did add in that the tuition loan repayment could be, or the loan repayments could be for courses at a community college, recognizing that nurses do take significant amounts of community college programming at the beginning. So they wanted to make sure that that was available. And they did not change the amount in that program at this point. Again, they're going to be continuing to look at that. Probably the most significant changes of these programs has been in the healthcare loan repayment program, which they have changed to an award program. So this is no longer a loan repayment program. It is an actual financial award to a nurse or physician assistant or a nurse educator who practices in a rural community, and they would get a cash or check of $6,000 a year for up to 5 years. So if you don't have loans, you've gone through the program, you would still be able and eligible for this program. They doubled the amount available to $500,000, and I think you're going to see a lot of demand for this one. They added that part-time practice eligibility, and also specifically said you could be a nurse educator practicing part-time. So if you were at Iowa State and we're helping add to the shortage of nurse educators to get more nurses in the pipeline, you could also practice part-time and be eligible for those awards. So I think that was another important change that was made. Probably the one that got the most attention this year certainly is the Mental Health Professional Loan Repayment Program. Previous to this program, there was never any program, loan repayment program in the state that's a state funded that specifically is focused on mental health professionals. So to knowing that there's going to be a huge interest in this, they limited it to non-prescribing mental health professionals, given that PAs, psych ARMPs, and others, psychiatrists have eligibility under the other programs. So they focus this on just those non-prescribers. So a psychologist, not a prescribing psychologist, but a psychologist, a licensed mental health counselor, a marriage and family therapist, or social worker would qualify under this. And it's full or part-time, although part-time is a longer commitment level. It's specific to the specific types of loans that many take out, and it includes interest and principal, $8,000 a year up to $40,000. If you don't, I should say, there's the rules to this just came out, so it's still in the process of becoming formalized, but at this point, they're not going to try to recoup if you don't do your full 5 years, you just don't get any future money. For a psychologist that becomes a prescribing psychologist later, you would become ineligible for the program after you start to prescribe, but before that, you wouldn't have to do any kind of repayment or anything like that. And so they funded that at $520,000. They actually started at closer to $1 million in this program. But in negotiations, it was now 520. The plan is to allocate that by profession. So you'd split up the number that you would be able to fund under that 520,000 amongst social workers, amongst psychologists, and evenly spread that out. And I think that's an area where you'll see maybe some changes happen as they start to see patterns on how demand works with those. So there were a couple other things that were addressed. Psychiatric residencies and psychiatric access is huge, as you know. Rural psychiatric residency program was increased had $200,000 more, which will pay for 2 more residents in the state, specifically in rural areas. So 6 residents total for $800,000. So they're making some progress there. I think there is a hope that there would be more demand in that program. There hasn't been high demand, so they're hoping there is more demand in that program. And then they created a new psychiatric residency program that's specific to state institutions. So probably you're going to mark Glenwood off that. They're not going to be recruiting there since that's closing, but Eldora, Oakdale's, the correctional facility there, Woodward, State Resource Center, the MHIs, so the Cherokee and Independence MHIs, mental health institutes, and Eldora is the state training school for boys. So that would fund 12 new psychiatry residents in those specific programs. So not a private program that would allow access to those residents, but they're hoping that they train them there and then they will stay in Iowa and practice, hopefully in other underserved areas. And so also you probably heard the governor talk about in her state of the condition of the state about Pella and some other communities that are doing innovative ways to get high school students interested in pursuing healthcare careers. And so they're calling it a Health Careers Registered Apprenticeship Program. They did not get state funds for this. Instead, they're using the federal recovery funds called ARPA that the governor has discretion over how to spend. So she's dedicated about $2.5 million. And just recently gave them out to 8 different communities to do purchase some virtual reality equipment so that they can create these school to career opportunities. So a lot of, like in Pella, I believe it's mostly a CNA type program where they're working with a local nursing home, getting kids those during their high school period, real work experience, and then also getting their CNA so they have a leg up when they start nursing school and hopefully get more interested in pursuing that career. So helping to fill that niche of shortage in the CNAs and help with those providers, as well as getting people into that pipeline. So more people are going through that. And so I just put the link on there. It is a really new program. So you can see where that will be. Sorry, I got a lot of blocks here opening up. Also, so another strategy that legislators use, moving away from more of the traditional loan repayment programs and trying to incentivize people to go into those rural communities, is really a continued focus on professional licensing to make it as easy as possible to practice in your profession in the state. And this is for, I mean, they've been doing this for all types of licensing, from, you know, electricians and other things straight through the healthcare professions. But they have directed all of the state licensing boards to eliminate exams for any person that's already licensed in another state. So as a condition for registering licensing here, there's still some conditions that apply, but in general, if you've passed an exam in another state and been practicing, they don't feel that Iowa should have its own Iowa specific state license. I understand there are some professions where like electrical licensing where that'll still apply, but in general, to get rid of that or eliminate it in some way. The expediting any kind of military spouse or veteran professional licensing. So if they've gotten those education and training and that have met licensing standards, they're directing the boards to immediately grant a temporary license. You know, and if there is additional training and education that we require in our state, allowing them to practice till temporarily licensed until they can get that. So there'll be some rules that all of the state boards are going to start to process through, and I think some have already started that. And then they also have directed them to recognize the training and service and education somebody receives while in the military, either in active duty or through the National Guard, in meeting those requirements. Another thing they're going to do is waive fees. So the licensing fees for any first-time applicant, or if they are at or below 200% of the federal poverty level, which I think is about $30,000 for a family of 3. I might be wrong on that. That's in my notes that I don't have right access to, but it's a pretty, a lot of students coming out of schools may actually meet that requirement. So it's just that first time application fee that would be waived, and then future ones would apply. Same for military veterans, they would waive their application fee and their first renewal for that licensure. And so they've directed the boards. It does take about 9 months to get rules through the pipeline and through the process that they go through to be adopted. So they have until July 1 of 2023. So I think you're seeing all the boards working pretty quickly to try to address that. And I think they're going to try to have it, from what I understand, those that are in the Department of Public Health are really working together to try to make sure that they use similar language, that it's very similar across the boards. So probably some of the things you all are most familiar with are more scope of practice changes, so that you've heard probably legislators talking about practicing to the fullest extent of their license. So trying to remove any kind of restrictions, not really opening up scope of practice, but really allowing that profession to fully practice. And so 2 places where that was really significant this year was they allowed nurses to vaccinate under a pharmacist order without getting a farm tech license, which I didn't even know they had to do the dual licensure, because vaccines are already within the scope of a nurse's practice. But when they're in a pharmacy or a Hy-Vee and giving out those vaccinations, they have to also have a pharmacy technician license. So that is no longer a requirement. They strengthened the practice of PAs, which I think you've probably heard a lot about. That was a big bill with the PA Society. We have come so far in the discussion of PAs from when, you know, there was that ongoing fight with the physicians, that this bill really kind of was a massive code cleanup, where they went through and made sure that PAs were included where they needed to be so that they could fully practice. And there's some examples there, like working in hospice and helping with end-of-life decisions, adding them in with other mental health professionals when they have had that specialized training, allowing them to treat patients within the adult and juvenile justice systems, allowing that performance of routine exams, for school bus drivers and others, all of those routine things that were scattered throughout code that just didn't have PA in that list, and then making sure that they have representation on those boards that are really making decisions on policy and on other areas. So some other updates that were addressed to help try to address shortages throughout the state. They allowed doctoral psychology students to be issued a 2-year provisional license during their student internship. So that was really a reimbursement issue. A psychologists do a pre-doc year and a post-doc year of supervised internship, but they couldn't get paid for the pre-doc year. So guess what happened? All of them dried up. They have to go out of state to get that 1 year. So this is really a matter of being able to get reimbursed for the services provided. And that was done a couple of years ago. I get messed up with pandemic timeline, but sometime pre-pandemic, right before the pandemic, they did this for social workers and some other mental health professionals to allow them to be reimbursed while they're going through their supervised internship or supervised fellowship. They also, in ongoing efforts with telehealth, prohibited insurers from excluding out-of-state telehealth companies from their networks if the professionals are licensed in Iowa. So that was a battle. And I think probably the healthcare community is mixed on this because it is out-of-state competition, but they really felt like it's an essential to have that telehealth availability in rural areas when you just can't get an Iowa resident Iowa professional to provide the service. So they did prohibit that. I have not seen how Wellmark and other insurers have responded to implementing that yet. And that was really by one telehealth company that was working on that. I think you may see more in that space coming up in future years. Particularly, I think there's still a renewed effort to try to get audio only telehealth approved and to get mandated parity for physical health services, some payment parity on the telehealth side for things other than just mental health. So I think those are two things that you might see some movement on next year. I'm at a site visit here in Sioux City with Ann Meyer, Representative Ann Meyer, and she was very interested in continuing the discussion on telehealth at the Capitol. She chairs the Health and the Human Resources Committee in the House, and is a nurse. Also you're well aware of the temp agency issue, specifically with nurses, but in other professions as well. Legislators were really upset at some of the lack of oversight on the healthcare employment agencies and the feeling that they are taking from the workforce and then charging exorbitant rates for that workforce, and making it a real struggle for local, particularly rural providers. And so they're now requiring them to register with the state. They're prohibiting them from requiring non-compete clauses. So if you like somebody that's working with you at a temp agency, you can hire them without a non-compete clause interfering with that ability there. And so a lot of that, there's a lot of new requirements that are on the healthcare employment agency. They're also going to have to report so that they can see what kind of trends are happening with the funding and the amount that's being paid. So there's just a lot within that area that legislators are going to be continuing to look at and making sure that it's enforced in the way it needs to be. I think Department of Inspections and Appeals is who is the agency that'll be hearing complaints or regulating in that area. Really trying to allow providers and nurses to have the opportunity to stay with a place if they like it there, and not have to pay additional fees and fines. And so so that was a significant change as well. I wanted to look ahead before I get to your questions, but looking ahead at some of the things that we see coming up next session. And I do believe there will be a whole lot more to add to this list, as I know a number of organizations are looking at other options that they might suggest to address workforce. But, you know, I don't necessarily add tort reform to a workforce issue, but those that are involved in that discussion do. They say it's necessary to change, you know, the tort reform to make changes so that medical insurance is not so high in the state, and it really doesn't become a barrier to practicing in Iowa. Malpractice insurance, sorry, I had the wrong term, malpractice insurance. And so that's definitely, they took a shot at it last year, almost got it. I think there were, I've heard anywhere from 10 to 4 votes away from being able to pass that. So you will probably see that being one of the top issues this session. Certificate of need, which I know everybody has different views about that depending on where you're at and if you've ever been through that process. But that is the process that facilities have to go through to purchase new equipment, expensive equipment, or build a new facility. And there are a group of legislators who feel that is a barrier to somebody practicing in their profession. And others say it's needed to keep costs down, keep not-for-profits out of the marketplace and draining away from those who care for more of the safety net populations. I think in rural areas, you all know it's been an issue with the maternity care. And so having those birthing centers out and available throughout the state, that, you know, it was spotlighted in this Quad Cities area when a behavioral health facility couldn't be built, even though I think you could pretty much argue that anywhere in the state is an area of need for those services. The perception that a hospital may block something. You know, I think there's definitely going to be a renewed discussion on certificate of need, how they address it, and whether they address it really with just the maternity issue, or if they raise the, you know, the amount of investment before you trigger a certificate of need. That all of that stuff is being discussed, and legislators are definitely tying that to a workforce issue. I think there is a lot of discussion of whether that helps or hurts rural areas. And I think communities are going to have to be prepared to answer that for your legislators. The lay midwife, I call it that because that's what it's been called, but it's really creating a new level of licensure for certified professional midwives. So not nurses, but those that have been through a training program and have met certain criteria, that there would be a kind of licensure level that would professionalize them. Because as some of the people who testified say, people are out there doing it, nobody knows whether they've had the level of training that's required or should be required. They did exempt a few ethnicity communities that have their own sort of system, indigenous communities, and I can't remember the other, if it was Amish or something, but they have their own group. So there were a couple exemptions on that, but it really, the nurses worked with the certified professional midwives in the state to kind of come up with something that they felt was reasonable. It kind of all blew up in the end and didn't pass. So, and the House and Senate couldn't agree on it. So I think you'll see more discussion. I don't believe that it'll actually end up passing with the level of differences that you have in approach, but it's something that they're continuing to work on. A couple other things, medical residency has been a hot topic, and how many Iowans are accepted in medical school, and trying to get the University of Iowa to accept more medical residents and try to keep more of our folks in the state. There's been all kinds of discussions about mandating that any qualified Iowa person, Iowan, be accepted over others. You get resistance from the medical schools, but I think there's still just a discussion about that. There was an interesting, the state ombudsman who hears complaints from Iowans. They're actually in the legislative branch. They had asked to have access to confidential licensing board investigations. So that became really concerning, because I think every health profession in the state spoke against this bill about allowing things like impaired physician information, or any kind of complaint, whether founded or not, they would have access to that, and they have no similar requirement of confidentiality that the boards have, and there was a lot of concern about that. The ombudsman said they're coming back next year with another plan, so I think that's something to watch, as not something that helps workforce, but might hurt workforce issues. And then I know the hospitals are talking about the rural emergency hospital model that passed federally, and Iowa would need to respond with its own code changes to make that a category of hospital in the state. So I know there was discussion about doing it last year, and with all of the certificate of need and everything else happening, but I think I read Keokuk Hospital is closing with 30-day notice, which is scary that a hospital would close with such a short period of time. But I think that will help drive that discussion to the forefront at the Capitol. They've got a lot to do, and this could be a pretty complex addition to our code and getting the writing right. But I think that there is some push to seeing how we can create a system to sustain at least emergency access, emergency room access out in those rural areas, so that you don't become deserts, because obviously that has economic impact too to the community. And so I know all of those things are going to be still around for this next legislative session, which I can't believe is just a few months away, after an election with new legislators. We have at this point at least 54 members of the legislature will be new. So out of 150, 54 new faces at the Capitol. I know there are 2 doctors running. I don't know if they'll win, but there have not been physicians in the Iowa legislature for a while. And so 2 are running. It looks like they will. I won't make predictions, but if you just look at the numbers, they probably will. But I think that's encouraging. You're going to get some more. You've got some nurses in the legislature. It's good to have those with that actual experience of being a physician or a healthcare provider and available there. So, but I always add that to the end, that I think it's important that, when you look at healthcare workforce solutions, there's a lot of legislators that don't know the challenge that are being faced in rural areas. And so it's important that they understand those in order to make appropriate choices. And so it's a really great opportunity now and moving forward to really educate people with what the challenges are. It's not lobbying, it's just educating. So I think it's always good to have people understand, so when they're making decisions at the Capitol, they're really doing things that are going to help address the situation. So the good news is they did a lot, and the better news is they're going to continue to do it. And there's commitment on both sides of the aisle, both sides of the rotunda, to making that happen. And so it's just unfortunate that there's no one silver bullet to get it all, make it all happen. It's going to be a series of things to address it. So I thought I must have talked fast, because I thought I was just only going to have about 10 minutes for questions, but we actually have a lot longer, 20 minutes for questions. So I'm hoping some of you might want to talk about something. I will at the end put up my email and my cell phone. So if you want to text or email me a question that you think of later, I'm happy to answer those questions now or moving closer to the session.
Yeah, and feel free to unmute yourself or just put your question in the chat.
I'll give everybody time to type.
Hey, Amy, this is Kyle. Question for you. In terms of some of the things that you think are on the horizon to be considered, are those going to be lumped all together? Are they going to be attached to other bills? Are they anything going to be on its own?
Yeah, I think they're going to be on their own at this point. At least those top ones, I think, are going to all be separate. I don't think you're going to see them like you saw this year. People called it the Frankenstein bill because there were so many odd things in their workforce bill. It looked like it was all sewn together. I think you're going to see separate bills this year. However, I say that, Kyle, but I just met with Senator Schultz yesterday, Jason Schultz, who chairs the Commerce Committee, and he said that the direction he's gotten from leadership is they're going to have to limit the number of bills each legislator is allowed to introduce, or each committee is allowed to introduce. I don't think they've been given a cap. So while I say they're planning on it separately, if that's the case in the Senate, you might see more pooling of ideas together. But then those become really tough to pass because you have so many different pieces that somebody can
Sure.
disagree with, but at this point, I think they'll be separate, at least those big ones. I'm also interested if people have other ideas on solutions for it or other challenges that you have. That's good feedback to have too, in terms of giving that back to legislators. If there's things that you see that that the state's missing here. I can't sing, so I'm not gonna sit here. I have no other way of entertaining you today.
If you guys have questions after that you think of, you can always put it on our listserv and we can forward that to Amy. And that's a good way that we can get that to everybody, all the IARHC members. Thank you so much for joining us today. We'll let you off early with some time back for yourself. Thank you so much, Amy, for all that information. It was great.
Yeah, and please do reach out however you do. And if you have ideas, I'd love to hear those too. I know probably Hannah and Virginia do too, so
yeah.
Thanks.
Amy, do you want to put your info slide?
Yes.
Oh,
right.
For those that are still left, can catch that. And
Hannah, I got on late, but I think this is recorded, right?
Yep, it is.
Okay.
Yep, so it'll be on the website. I'll get it on there this afternoon. So feel free to also pass it around with your colleagues.
Yep, and a lot of the bills I didn't refer to them by bill number, but a lot of the changes are in your bill tracker now, which is at that ialobby.com site. So you just, if you want to actually look at what all of those changes were, you can find that in the bill tracker on that site. But you can reach out to either Craig or I Craig's on the tour, so he isn't here. He's here, but he's not on this webinar with me, but you can reach out to either one of us. We communicate every day.
All right.